For today's content, as you can see on the screen, we're just going to look at the respiratory system. Just a quick one as well. With this, don't worry about completing any tasks or anything like that. All I want you to do today is look through it, listen through it, read through it, and make some notes. Don't spend any longer than half an hour to 45 minutes on it, and with the rest of your time, just get away from the computer screen, go and do something. Because I know a lot of you are being put under quite a lot of, not pressure, but you're having quite a lot of stuff thrown at you. So use that time for yourself. So in terms, like I said, we're just going to look at the respiratory system. It's a bit of a whistle-stop tour. I'm aware most of you will have done stuff like this before, so I won't be making it too long in terms of the video, hopefully. But we're just going to cover the topics that often come up through the exams. Even obviously, you don't have exams until next year for the first years. Second years, obviously, still thinking about what's happening with your exams at the minute. All right, so I've included this more just so that for information purposes. I'll be honest, you very, very rarely get asked to label a diagram on the actual respiratory system, but it's worthwhile making a note of and just having a look at so you're aware of where different things are. So you can see where the air would come in from your nasal cavity in the mouth, and then you can see it traveling down it through the pharynx, then the larynx, down the trachea. Obviously, you've got your two lungs either side of that trachea, and then you've got your bronchus, which splits into right and left, and then they turn into bronchioles, and then eventually into alveoli. Now, it's mainly kind of the alveoli where we focus around in terms of things like structure, so being one cell thick, all that kind of stuff. But just be aware of this. Obviously, if you go on to study sport further, you will look at this in more detail. I've also included the epiglottis. So the epiglottis is that it's like a flap that covers, so when you're eating, you're not going to choke on anything, and when you're breathing, that'll open to allow the air in. Lots of functions. Again, I'm not going to spend time on it. This is what I mean. If you want to make a couple of notes on these, that's absolutely fine. But again, I wouldn't worry too much about that side of stuff. Just being aware of it. Okay. So obviously pause the video if you want to make some notes. If you don't, that's all right. Okay, so the first thing that we want to look at and we want to make ourselves a little bit more aware of is a spirometer trace. Now, all the spirometer trace is doing is it's basically keeping a track of your breathing volumes. Okay, so when we're looking at these, it's called lung volumes, and we're looking at the patterns of breathing within here. We have to be aware of all of these. So the first one that most of us, again, will have heard of is tidal volume. Now, tidal volume changes. Tidal volume is the red line. So tidal volume is the amount of air in and out in one breath. And that can change depending on what you're doing. How it changes is it uses these two here. So it uses either the inspiratory reserve volume. So inspiratory reserve volume would be the amount of air above resting levels that you can still breathe in. So right now you sat there and you're just breathing in and out quite shallow, maybe it's like 500 to 400 milliliters, depending on how big you are. So the inspiratory reserve volume would be if you took a big deep breath in, your tidal volume would go all the way to the top if you're taking a deep breath in as far as you can. And then similar with the expiratory reserve volume, but instead of taking a deep breath in, this time we're going to be taking that deep breath out. Okay, so expiratory reserve volume would be the amount of air left that you could expire after a normal breath, okay, or a normal breathing pattern. Now, when I'm talking about these things kind of change, all right, you can see towards the end here where we're looking at tidal volume increasing during exercise. So tidal volume, depending on what you're doing, will increase. So if you're starting to go for a walk instead of sitting there, tidal volume will start to go up. And if you start to exercise, your tidal volume will increase even more. So the amount of breath that you breathe in and out in one breath would be your tidal volume, okay? And then the bottom bit here, residual volume. Now, residual volume never ever changes. It's the amount of air that we have left in the lungs, and it prevents the lungs from collapsing. Okay, so lungs are very sticky inside. If we lose all the air out of the lungs, obviously they would stick together and be very, very difficult to inflate again. So that's what the residual volume's there for. It makes sure that that's not going to happen. Also being aware of what vital capacity is. Vital capacity is basically the amount of kind of air, that usable air that we'll have in the lungs. And then the total lung capacity is the vital capacity plus residual volume. So total lung capacity, very dependent on the person. Tends to be people who are taller, maybe broader shoulders. They may have a larger lung capacity. So if you think of people like a swimmer, tend to be quite tall, quite broad. They tend to have quite large lungs, which helps them in their event. So if we're looking at total lung capacity, doesn't really change. It's determined by genetics. The amount of air you can get in and out of the body can change due to adaptations. It's like capillarization around the alveoli, getting more air in and out. But actual total lung capacity, it doesn't really change. Okay. Other thing we need to be aware of is that tidal volume, when we times it with breathing frequency or breathing rate, so tidal volume times breathing rate, we get something called minute ventilation. Now, if you think about minute ventilation is just literally the amount of air in and out in 1 minute, okay? And that's affected by 1, the tidal volume, so the amount of air you're breathing in and out in one breath, and 2, the breathing rate, so the amount of breaths you take per minute. So the more breaths you take per minute, minute ventilation will go up. The more air you take in and out in one breath, minute ventilation will also go up. So when you're exercising, minute ventilation will go up. And I've got a question coming up later on just to explain why minute ventilation is important and the type of questions you could get asked on minute ventilation. So again, I've just went through all of that, but again, I know like some people prefer reading, so I've left all that on there. So if you want to read through that at any point, absolutely feel free. So types of questions we can get on this section, one up here. So which one of these statements defines expiratory reserve volume? And we said that that's the amount of air that we can expire after a normal breath. So if we're looking at this, the volume of air that you can forcibly expire after a normal breath would be expiratory reserve volume. So the answer for that one would be C. And then this part is the bit I was just talking about there. So minute ventilation, so tidal volume times respiratory frequency, which is just another word for breathing rate or breathing frequency. So the amount of breaths taken per minute and the amount of air we take in and out in one breath would be C as well. That would be minute ventilation there. Okay, important that, and I've put this question in on purpose just because they can change this term. So respiratory frequency, breathing rate, or breathing frequency, and they tend to use those three all interchangeably, all mean exactly the same thing. So just the amount of breaths you take per minute for that. Other questions that we can get: identify one of the following statements. Oh, I've already done that one, my bad. You've got other ones like labeling ones here. So which lung volume is represented by the letter B? So again, if we went back to that spirometer trace right at the beginning, we would know that that was the inspiratory reserve volume because it's the amount of air above, so the amount of air we can still inspire. And then what would be the effect on the spirometer trace for lung volume A of a period of continuous running? So for this, we'd be talking about tidal volume would increase because we need to increase the amount of air we're taking in and out. What else would happen is that these lines here represented by tidal volume will get closer because our breathing frequency would also increase as well. Okay, so not only would these lines go further up and further down, they'd also get closer together because your breathing frequency is speeding up. All right, the amount of breaths per minute you're taking is also increasing. All right, so that's what we'll be talking about for that type of activity there. That one normally catches people out because they always say, oh well, tidal volume will increase, but they always forget to put in that breathing rate will also increase as well. So that's how we change the line. One other question you might be asked is, how are B and C affected by exercise? Well, B and C, when we exercise, they actually decrease because tidal volume starting to use the reserve. So if we increase in A, which is tidal volume, B is going to get smaller, so inspiratory reserve volume is going to get smaller, and C, so expiratory reserve volume, would also get smaller as well because we're using that reserve. We're breathing in more and we're breathing out more as well when we're exercising. So this was the other question I was on about. So explain how the cyclists' increase in minute ventilation allows them to maintain performance throughout the race. So we've got to think again, so what is minute ventilation? So we've said minute ventilation is the amount of airflow in and out per minute. Okay, so increasing that airflow, how's that gonna help? Well, one, we're getting more oxygen in. Okay, so if we're getting more oxygen in, we're going to be able to deliver that oxygen to the working muscles. The muscles are going to be able to work for longer and at higher intensity because we're able to generate that energy through the aerobic energy systems. Another thing we can think about with oxygen, it's going to help us oxidize lactic acid. So it's going to help us to reduce lactic acid as well. So that would be another valid point to be putting in there. And then another point you could put in, well, if we're breathing out more, we're breathing more carbon dioxide out. So hopefully the acidity in our blood, it won't build up as much, therefore we won't fatigue as quickly. So those will be three things as to why minute ventilation helps a performer. So that cyclist there, that's why it would help that cyclist. They're able to perform at a higher intensity for a longer duration, which is due to the oxygen delivery, allowing our muscles to create that energy. The oxygen delivery also gets rid of lactic acid, and us breathing in and out faster and breathing in and out more is also going to mean that we can breathe out carbon dioxide faster and hopefully reduce acidity in the blood. Okay. Now, other things we need to be aware of is pulmonary ventilation. This basically means how we breathe in and out. Okay, so again, this slide here is a little bit more text-based. So if people like to read text and read through the paragraphs, absolutely read through that at your own in your own time. So inspiration, and we're looking at expiration as well. So inspiration is obviously breathing in, and this is the mechanics of breathing. So if you imagine how something actually works mechanically, this is what happens when you're breathing in and breathing out. So you can see there, we've got the intercostal muscles. They will contract when we breathe in. And when the intercostal muscles contract, they're between the ribs. So they'll lift up the rib cage, okay? And at the same time as those intercostal muscles contracting and lifting up the rib cage, your diaphragm also contracts. And when your diaphragm contracts, it flattens, so it moves down, okay? When it's relaxed, it's like a dome shape. But when it contracts, it moves down. Now, why that's important and why the rib cage lifting out is important is that it's going to create more space in your thorax or your thoracic cavity or your chest cavity. All mean the same thing, just different words. So it's going to create more space in there. Creating more space is going to decrease the pressure. Okay, so again, if you imagine you take more people out of a room, or you make the room bigger, that's going to decrease the pressure within that room. And it's the same here with air. So when we decrease that pressure, we're now going to get a high pressure air outside and a low pressure inside. We know that things flow from a high to a low concentration. So what we're now going to get in, because we've decreased that pressure inside, we're going to get that airflow coming through into the body and into the lungs. It's going to be drawn into the lungs. Now, that's quite a passive process at rest. During exercise, we do have two other muscles that help with that. So inspiration, when we're breathing in, there's a muscle called the sternocleidomastoid that helps to draw air in. It helps to breathe air in. It's a muscle that's in your neck. So when you see people like really panting and puffing for air, you'll see those neck muscles working. And then there's a deeper muscle in the neck called the scalene, and it's also the scalene that also helps breathing in. Okay, so breathing in, there's those two other muscles during exercise that also help. And now breathing out, it's exactly the opposite. So when we breathe out, the intercostal muscles relax, the diaphragm relaxes. That creates a smaller space in that thoracic cavity, that chest cavity. And then what happens is it increases the pressure within the lungs and air is pushed out of the body. Okay, so it's exactly the opposite. If we're exercising for expiration, if I asked you to breathe out as quickly and as hard as you can, you'll feel your abdominal muscles contracting as well. All right, so when we're breathing out, the abdominal muscles also aid us breathing out. Okay, and like I said, those were the paragraphs kind of for people to have a look at and read through. And this is just a simpler way of doing it. So the diaphragm muscle contracting and flattening, the volume of air inside the chest cavity increases, the volume of space, sorry. Same time, the intercostal muscles contract, the rib cage lifts up, lungs are pulled outwards, and the decrease of pressure allows airflow into the lungs from the outside air. So that one will be inspiration, and the next one would be, and there's your spellings of those muscles as well, sorry, so sternocleidomastoid and scalene muscles aid in inspiration. This one, sorry, should say expiration here at the top. So breathing muscles or breathing mechanics for expiration is the intercostal muscles relax, the diaphragm relaxes, that decreases that thoracic cavity, that chest cavity space, and the lungs return to their resting size, increase in pressure, and then that forces the air out. And those abdominals will also force the air out as well. Okay, So just think of the types of questions you could get. You know, again, you can make this as a note. You can answer them if you want. It's entirely up to you today. So describe how the process of inspiration and expiration differ at rest and then during exercise. And then what are the breathing mechanics for inspiration? Okay, so like I said, the mechanics is what's moving. So the rib cage is moving, the diaphragm's moving. What's causing that to move? Well, the intercostal muscles are contracting to cause the rib cage to move. So always remembering that the mechanics is the actual movement part of stuff. Okay, think of it as the car. You know, the mechanics, so the wheels are moving around or the suspension. That's the mechanic side of stuff. Okay, because what we're going to do now is we're going to move on to the control of breathing. So when you start to breathe faster, what drives that? Okay, so what tells that diaphragm and what tells those intercostal muscles to actually work harder? All right, because again, it's a subconscious thing, and the nervous systems look after the control of breathing. So what happens when we exercise in terms of the actual control of breathing itself? So again, we come back to something that you've heard of before, something we're similar with. So chemoreceptors, we know that are located in the blood vessels, and within the blood vessels, these chemoreceptors, they're detecting different chemical changes in the blood, and in particular, it's looking for the acidity level in that blood. Okay, so when we start to exercise, we get an increase of carbon dioxide in the blood, and that increases the acidity level that's in the blood. Okay, so remember, chemoreceptors don't detect carbon dioxide, they detect acidity. Okay, but it's the carbon dioxide that we produce through exercise that causes acidity to increase. They send some information via the neural networks, via nerve impulses, up to the respiratory control center, and that's located in the medulla oblongata. Okay, so that's within the medulla that we've talked about before, that section of the brain. Again, if you're in the exam, if you've got a question and you can't quite remember the respiratory control center, you can put RCC, or you can just put the medulla. Okay, unless they're being really harsh, you'd still get the mark for saying the medulla. Okay. So that information sent by a nerve called the phrenic nerve. Now, the easiest way to remember that the phrenic nerve is the breathing nerve is remembering that the diaphragm is involved in breathing. Now, the diaphragm has a pH in it, and the phrenic nerve has a pH in it as well. So that's like, it's a subtle link, but it sometimes helps just to trigger memory. Okay, so if we can remember diaphragm, phrenic, remembering that pH is it within both of those, and the diaphragm's only involved in breathing for us when we're on this course. Okay, so diaphragm and phrenic nerve there for you. So the phrenic nerve is going to have a factor played in this. It's going to cause other things to work harder. What the phrenic nerve does is it sends a message to the breathing muscles and basically says, look, we're exercising, the body's exercising, the acidity in the blood's gone up. We need to start working harder so that we can try and get this acidity level down so that we don't fatigue, so that we can continue to exercise. Okay, so it says to the breathing muscles we need to work harder, so it activates the diaphragm and the intercostal muscles, and it increases the activity of those two breathing muscles, and that's going to lead to an increase in breathing rate, and it's going to lead to an increase in tidal volume as well. Okay, and we've got to think about, why do we need this to happen? One of the simple reasons we need it to happen is we need to speed up gas exchange. We need to get more oxygen in to those muscles, and we also need to get more carbon dioxide out. So we need to speed up the gas exchange between the lungs and the blood and the muscles in the blood as well. We need to meet the demands for oxygen at the working muscles. So if somebody's going for a run, but they're trying to run maybe like a 5 or a 10k PB, it's important they get this oxygen demand met, or they're not going to be able to sustain the intensity. They might still cover the distance, but the intensity won't be able to be maintained to set like a new PB. Okay, so we need to make sure that that oxygen's getting delivered. And it's also to remove carbon dioxide. We've already mentioned this. It neutralizes the blood. It won't quite neutralize it. There's always acidity in the blood. We need acidity in the blood. It drives breathing. Okay, if if the body doesn't detect anything like that, the body won't see a need to actually keep breathing. So we do need some. So it won't totally neutralize it, but it'll bring it back down to some sort of range where we're not going to fatigue too much. Okay, so it can remove blood carbon dioxide as well. So if you want, create a task flow chart. And again, it's just kind of making notes to get it in your minds and to create revision notes really in the long run, so that when it comes to exams or sitting maps or any assessments that lead towards your grades, that you've already got the revision notes there, so you're not having to panic and go over them. So chipping away is a good idea, but again, I'm going to leave that up to you. So if you want to do that, pause the video and do that. If you don't want to, we're going to continue going with this video. So the next little bit and the last little bit is looking at gaseous exchange. Okay, so gaseous exchange, we're probably aware of this already. It's known as diffusion that we're going to be looking at. So diffusion itself, if you ever get a question on gaseous exchange and diffusion, you have to give a definition of what diffusion is. Okay, so diffusion is basically moving from a high concentration to a low concentration. And if you put that in there, if you say diffusion is the movement of particles or the movement of gas from a high to a low concentration, 1 mark straight off the board, straight in. Okay, dead simple, dead straightforward. If you spray perfume or aftershave or all those link sets that you might have got at Christmas, lads, you'll know that if you spray it in one corner of the room and it travels across to the other, it's because it's traveling from that high concentration where you first sprayed it into the rest of the room where there's actually a low concentration of that particle in the air. All right, and eventually somebody over the other side of the room will smell it, and that's it traveling across the room. Gaseous exchange in the lungs. So the ones that we've got to be aware of is gaseous exchange in the lungs and gaseous exchange at the muscles. Now, gaseous exchange in the lungs, what we're seeing there is we're seeing that the lungs have the high concentration of oxygen. They're just breathing in that air, they're breathing in that oxygen. So within the lungs, in the alveoli section, so you can see this diagram here, this is the alveoli, this part here, this almost like shape of a grape. That's the alveoli there. So it's having the oxygen coming in because we're breathing in that oxygen. Okay, so we're breathing in that oxygen and we're going to have a high concentration of oxygen in the alveoli. What you'll find in the bloodstream, because this blood coming back from the body, so is already used the oxygen and it's now carrying carbon dioxide. So there's in the bloodstream around the alveoli, there's a low concentration of oxygen, but there's a high concentration of carbon dioxide. Okay, so if we think, right, well, you've just said to me that oxygen is high concentration in the alveoli, but a low concentration in the bloodstream. We know that applying diffusion to that, high concentration to a low concentration, well, oxygen flow is going to go from the alveoli into the bloodstream. Okay, and I've also just said that carbon dioxide is a high concentration in the bloodstream, but it's going to be a low concentration in the alveoli. So again, if we apply what diffusion is, the high concentration of carbon dioxide in the bloodstream is going to go into the alveoli, and then from the alveoli, it's going to be breathed out through the mouth, through the nasal cavity, and into the air that we breathe out. Okay, so oxygen at the lungs diffuses into the bloodstream, carbon dioxide at the lungs diffuses into the alveoli, and we breathe that carbon dioxide out. You can see that second little bit there, so sorry, the third bullet point, oxygen then attaches to hemoglobin. So once oxygen comes into the system, once it's in the bloodstream, it will attach to hemoglobin and be transported around to the heart first, and then the heart will pump it to the rest of the body. Oxygen can also diffuse into the plasma of the blood. So the plasma is what carries everything around. So plasma, almost imagine it as like just the liquid that everything travels in. So things like hemoglobin will travel in plasma, white blood cells travel in plasma, platelets travel in plasma. So all those things, plasma is carrying all that stuff around. So oxygen travels with hemoglobin and also travels in the plasma. Hemoglobin, just the red blood cell, for anybody who's still using that terminology. And then gaseous exchange in the muscles. So it's going to be the opposite. So now in the bloodstream, what we've got is we've got a high concentration of oxygen. So because that blood has travelled round to the muscle, it's travelling to the working muscles, it's taking oxygen to the working muscles. So what's going to happen, and if you're looking at here, is the oxygen's going to come in, it's going to deliver it into the tissue cell, into the muscle cell, and because the muscle's working hard, it's producing waste products such as carbon dioxide. What's going to happen is carbon dioxide is then going to diffuse out into the bloodstream, and then it's going to get carried away up to where the lungs are. Okay, so basically at the muscles, it's the opposite of the lungs. So at the muscles, we get the oxygen diffusing into the muscle because that's where it's needed. And we get the carbon dioxide diffusing out of the muscle because we need to put it back into the bloodstream so that we can get rid of it out of the body, transport it to the lungs and breathe it out. Right. These numbers here as well. So if you think about the oxygen concentration, so at this point here in the bloodstream is 100. In the tissue cell, it's only 40. So like already we know that's a high concentration. So it's going to go from 100 and it's going to go down into there and fill in there. And then again, if we look at this section here, well, at this point, that's only 40, that's 45. So carbon dioxide is going to come out. And you can see the arrows where they're pointing and everything like that to try and make it a little bit clearer. Okay, so as a result, oxygen diffuses into the muscles and carbon dioxide diffuses into the bloodstream. So again, the type of question you could get, this is the type of question that's come up loads of times, 4 or 5 marks. Consider how oxygen and carbon dioxide move between the alveoli and the blood capillary. So the alveoli we know is in the lungs. Even if you didn't know this, even if it took away alveoli or alveolus and the blood capillary, we can still do this by using the numbers. So if I asked you, where is oxygen going to travel? Well, in this shape here, which represents the alveoli, we've got 104 millimeters mercury. And in here in the blood capillary, we've only got 40 for oxygen. So again, we apply what diffusion is. Well, diffusion is the travel of gases or particles from a high concentration to a low concentration. So we know that oxygen is going to go from the alveoli into the blood capillary. If we talk about carbon dioxide, well, we can see the partial pressure. That's what the P stands for, partial pressure, or we can just know that as concentration as well. That's fine. Is 46 here, and it's 40 here. So that we know carbon dioxide is going to go from the blood capillary into the alveoli. Now, the only other thing to be aware of is the larger the difference, the faster diffusion is going to occur, or the faster those particles are going to travel across. So if we looked at this in real time, the oxygen particles will be traveling across faster into the blood capillary than the carbon dioxide that is traveling into the alveoli. Okay, so the larger the difference, so 140, the difference there being 64, and the difference here only being 6, the oxygen will be traveling faster than the carbon dioxide. So again, that's something to be aware of. It very rarely comes up in exams, but we do need to be aware of it. So if this was a 3 or a 4 mark question, define diffusion, say which way carbon dioxide travels, say which way oxygen travels, and then just mention, because of the difference between them, it can affect the speed at what diffusion occurs at. Okay, but that's everything. Obviously, I'm available if you do have any questions. Get in touch for anything. Could be courseware, could be content that we've covered before, could be content we're covering today. But please, like I said, please make sure you take some time for yourself. You're being inundated with all sorts. Get away from a laptop. Go for a walk, go for a run, listen to a podcast, do some form of exercise, do something, just to look after yourselves as well. Okay, we've also got that Beat Elite Challenge, Beat the Elite Challenge. If you're unsure of it, go to our Instagram, get involved. I've had quite a few people getting involved with that now, so it's getting pretty decent. Some good challenges on there as well. If you complete everything, I think you're in with a chance of winning some kit as well. Everybody loves a bit of free stash. All right, like I said, anything, get in touch. If not, enjoy yourselves. I will see you next week.